Hello everyone, my name is Katie. In today's podcast, I will be discussing wrong side surgery. Wrong side surgery is described as a preventable incident in the periop setting involving the following: wrong patient, wrong procedure, and wrong side surgery. Wrong side surgery is rare, however, it is still a major patient safety concern as it can result in a catastrophic event. Wrong side surgery was labelled as a never event, meaning an adverse event that is completely preventable through standardized checking protocols and should therefore never occur. Wrong side surgery was categorized as a sentient event, being an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof by the Joint Commission in the late 1990s. So I think a really important question to ask here is, why is it still such a prominent patient safety risk within Australia and internationally? During this podcast presentation, I will be focusing on the following topics in relation to wrong side surgery. So this will be current research findings, current policy and practice, patient risk factors, and recommendations. A system for reporting wrong side surgery in public hospitals in each state and nationally was developed in 2004. This resulted in the opportunity to measure the impact of wrong side surgery and analyze the effectiveness of the standard checking procedure. Prior to 2004, there was no formal reporting system. Therefore, the identification of trends tied to the implementation of risk assessment initiatives and prevention and management strategies was proven difficult, as there was no state or national reporting system for wrong side surgery. So for current research findings, Table 1, it demonstrates a comparison between states on the number of reported incidences of wrong side surgery. This data was difficult to interpret and there was no clear trends identified. For example, it is important to consider if an increasing occurrence of reported incidents was due to more wrong side surgery events or a better reporting system. However, the most recent publication in 2011 by the Commission reported 10 incidences of wrong side surgery, which does demonstrate a decrease in incidence. But further analysis of these reports made to the Commission in the coming years will need to be conducted to ensure this number continues to decrease and truly demonstrate a decreasing trend in incidences of wrong side surgery. In alliance with international initiatives, the Australian government have introduced simple and low-cost protocols to combat this avoidable adverse event from increasing in occurrence. In 2004, the Joint Commission published the Universal Protocol for Preventing Wrong Site, Wrong Procedure, and Wrong Person Surgery. This led to the development of the following policy, being ensuring correct patient, correct site, correct procedure protocol for surgery. The Australian Commission on Safety and Quality in Healthcare developed this initiative to provide a standardised approach for preparing patients for a procedure. The aim of this protocol is to decrease the occurrence of surgeries being performed on the wrong patient, wrong side, or wrong site of the body. In 2008, the World Health Organization developed an initiative which aimed to decrease the incidence of surgical death on a global scale. This initiative led to the development of the WHO Surgical Safety Checklist, which includes interventions to help minimize the risk of wrong site surgery. The checklist highlights the value of each team member in the theatre environment and describes how teamwork is an essential role in undertaking of surgery. Since the development of the checklist, communication and teamwork in the surgical environment has improved. The National Safety and Quality Health Service standards also plays an important role as a prevention and management strategy. The standard most relevant to this topic would be Communicating for Safety standard. This standard focuses on effective communication and documentation and ensuring this is completed in a timely manner for the aim of patient safety care. Effective communication will help to promote patient safety in the perioperative environment. So as you can see here in Table 2, it is a jurisdictional wrong site surgery prevention policy between the states in Australia, as there is currently a fragmented state-based range of protocols in place. The development of a standardized national approach for the prevention of wrong side surgery may be incredibly beneficial in reducing the number of incidences. According to Watson, there are 3 characteristics that are associated with wrong side surgery and seem to demonstrate the contributing factors as to why this is still occurring in the perioperative environment. These characteristics include human factors such as communication, culture, distraction, lack of reconciliation of patient information, ineffective team dynamics, and lack of patient participation. For patient factors, we have things such as emergency cases and unusual patient characteristics. For system factors, we have things such as time pressure for starting or completing procedures or logistics such as turnaround time, rescheduling, multiple surgeons conducting surgery during a procedure, and multiple procedures being conducted at one time. The prominent causes of wrong side surgery identified by the Australian Compensation Corporation in New Zealand were the following: misinterpreting a referral or radiology report, identification of the wrong site during surgery, marking of the wrong side of the patient during surgery, before surgery, and breakdown in communication between members of the surgical team. According to the Joint Commission, the prevention of wrong side surgery is achieved through developing a culture of safety and enhancing processes within the perioperative environment. Wrong side surgery can be directly influenced by human behavior, so it's super important for perioperative nurses to be aware of this. The main suggestions for the prevention of wrong side surgery include continuing to highlight the importance of promoting a safe culture within the workplace. The concept of team-based systems of care must continue to be a major focus within the healthcare system. Further research is needed to discover how tools such as the checklist mentioned before can be integrated into clinical practice effectively. And further research and investigation is needed to determine if a patient risk assessment initiative would be beneficial in reducing wrong side incidents. Further research is needed to investigate the concept of wrong side surgery in relation to nursing-specific interventions, perceptions, and approaches to patient care. This is also really important as there is not much research outlining the specific barriers in eliminating the occurrence of wrong side surgery. It is incredibly clear in the research that it shouldn't be occurring as identified in its classification as a never event, and more research is required within Australia, and therefore we need to push for more studies to be conducted on this topic, especially in relation to perioperative nurses and how we can impact on this adverse event. Thanks guys, I hope you really enjoyed this podcast, and I've also included a list of the references that were used to complete it.